morning. Thank you so much for the invitation. My name is Vinicius, and I'm a pediatric anesthesiologist from São Paulo, Brazil. And I'm going to talk about videolaringoscopy for cleft intubation. Do you have enough evidence? So, this is my institution, Hospital das Clínicas from University of São Paulo. Is my trained partner in São Paulo, Brazil. And those are my conflicts of interest. I'd like to thank Ismail Train for a grant for a fellowship scholar in pediatric anesthesia in my institution, and also a grant for the LASO SPEEDS, which is a clinical study protocol that we are starting right now. So, answering the question that I made in my presentation title, do you have enough evidence for videolaryngoscopy for cleft intubation in children? I would say yes. So I'd like to present to you the recommendation made by our colleagues from Europe, the USA, Canada, and Australia. This recommendation will be published next September in the British Journal of Anesthesia and the European Journal of Anesthesiology. And this is a draft because now they are discussing the last points of this recommendation. And it is a guidelines for airway management in children under 1 year of age, which is the year that the majority of children will be anesthetized to be surgically treated for cleft palate or cleft lip. And they have many recommendations in these guidelines, and one of the recommendations is regarding tracheal intubation. And they ask a question, is direct laryngoscopy the first choice technique for tracheal intubation in neonates and infants? And they do recommend videolaryngoscopy with an age-adapted standard blade, Macintosh or Miller, as first choice for intubation in neonates and infants. And they classify this recommendation according to grade as 1B. And remember what is 1B recommendation according to grade is a strong recommendation based on randomized clinical trials, and it applies to the most of our patients. So it's a strong recommendation based on several studies. And when you go to the literature and you review the physical risk factors for difficult intubation, difficult airway in children, labial palatine cleft is considered a risk factor during the physical examination and may be related to difficult airway in infants. So these recommendations were based in two important randomized clinical trials, both published in the Lancet. The first one that I would like to present to you is from Thomas River. Thomas River is our colleague, a pediatric anesthesiologist from Bern, Switzerland. And he did this multi-center randomized clinical trial and demonstrated that videolaryngoscopy performed better compared to direct laryngoscopy, especially in neonates and infants. And another colleague, Enery Garcia Marcinkiewicz from Philadelphia, USA, also published a randomized clinical trial, a multi-center randomized clinical trial in 2020. And she also showed that the first attempt success intubation rate was better when used videolaryngoscopy, especially for those kids under 6.5 kilograms. So we have a lot of recommendations, a lot of evidence. This is the most important one to be multi-center randomized clinical trials. So we do have enough evidence to use videolaringoscopy for cleft patients, but we must be or stay proficient in direct laryngoscopy, especially to train the novices, our residents, our fellows, and also for contingency strategies. Well, before I finish my presentation, I would like to invite you to participate in the LASUSPEEDS, the Latin America Surgical Outcome Study in Pediatrics, which is a multi-center cohort study fully supported by Smile Train. We aim to assess the incidence of postoperative complications in children, and that includes children with clefts. I also would like to invite you to participate in the cricket. It is another study, international study, led by our colleagues from Switzerland, which will describe the complications related to intubation in children. So it's very important, our participation. We need to have our own data, data from South America, Central America, Mexico, and the Caribbean, instead of really own data from the West. So please, if you want to participate, email me. This is my email, and I will be available during the meeting. Thank you.